Ladies and gentlemen, please welcome Captain Thomas McGue, Commanding Officer, Naval Health Clinic, Great Lakes.
Thank you, Admiral Stocks, and good afternoon, Captain Lovell, distinguished guests, fellow commanding officers, executive officers, command master chiefs, staff of both Naval Health Clinic Great Lakes and the North Chicago Veterans Medical Center. Also Captain Beardsley, and Mr. Sullivan's family and friends. But most importantly, good afternoon to the active duty members, the DoD beneficiaries, and veterans of North Chicago and Great Lakes. What I want to assert to you all today is that both this change of command and the dedication of the Federal Health Care Center are not about those of us on stage, but about honoring a commitment to those of you who have given so much to serve this country while proudly wearing the uniforms of the Navy, the Army, the Marine Corps, the Air Force, and the Coast Guard. The Federal Health Care Center is to be dedicated after this change of command. Is a bold reaffirmation of this country's commitment to the sacrifice of all presently in uniform, of those who have served in uniform, and for your families who work to secure freedom around the world. I can assure you that the staff of Great Lakes and North Chicago take this commitment with serious intent and will continue to do so as we transition into this nation's first ever Federal Health Care Center. The majority of what I have to say today is related more to thank yous. Command gives you the opportunity to work with a number of people who, frankly, make you look good almost all the time. I'd first like to thank the staffs of Naval Health Clinic Great Lakes and North Chicago VA Medical Center. While I can't name you all, please know that I truly appreciate what you have achieved at the deck plate level in daily delivering quality health care and service to our patients. You will be the heart of the new FHCC. You have performed superbly. I want to thank my senior leadership, Vice Admiral Robinson, who can't be with us today, but the Navy Surgeon General has been involved with this program since he took over almost 3.5 years ago. Admiral Stocks, Dr. Morawski, who have been integral parts of carrying this forward as we encountered a number of issues as we went along. And members of our leadership task group, particularly Mr. Ken Cox and Mr. Paul Hutter, who have mentored and directed me throughout this effort. I want to stop to take an opportunity to personally recognize a special individual for myself. This is retired Admiral Tom Cullison, who as the previous Deputy Surgeon General was critical in moving forward our efforts here in Great Lakes. We went to medical school together a long time ago, and so I've known Admiral Cullison for many, many years. Sir, and I'm looking, but I don't see, but Admiral Cullison, without your drive and assistance, we would not be standing here today on the verge of standing up this nation's first integrated federal health care center. And sir, I thank you. Bipartisan political support has been critical throughout our ability to move forward with this new endeavor. To Senator Durbin, Congressman Kirk, Congresswoman Bean, senior staff, Mr. Mullen from Senator Burris's office, I would like to thank you all for your support in helping celebrate this historic event and for getting us through the difficult hurdles we've had to achieve to make this part. Also with us here today is Dr. Winkenwerder, who in 2002 was one of the initial catalysts for moving this forward. So, sir, it's good to see you here today. I want to thank my present Command Master Chief, Ross Gilead, who along with an outstanding Chief's mess has been exceptional. It is this group of senior enlisted professionals who ensure that the sailors in the Federal Health Care Center will remain sailors and always be ready to deploy in support of operational needs as we have over the last 4 years. My Naval Health Clinic wardroom of 80-plus officers will continue to serve Mr. Sullivan and Captain Beardsley and the Federal Health Care Center to ensure that the pipeline to the fleet does not falter. Along with this superb wardroom, I have a phenomenal group of over 500 civilian employees who will be the cornerstone of Naval Health Clinic Great Lakes, who will bring the same dedication to the Navy mission and a commitment to the veterans and the DoD beneficiaries at the Federal Health Care Center, as will my enlisted and officer communities. I want to thank my XOs, Captain John Bloom, Master of Ceremonies, and before him, Captain Sue Lichtenstein is with us today. She's now the commanding officer of Oak Harbor Naval Hospital in Washington State. In each and every challenge, they faced and stood up and demonstrated their remarkable professionalism and commitment to the principles of being a naval officer. Thank you both. To my fellow commanding officers and my Brick Row neighbors, thank you for your comradeship during what at times has been a difficult undertaking. In particular, I want to recognize Captains John Malfitano and Captain Carolyn Ollinger, who have always been available for sagacious counseling over at the Port of Call on our first Fridays. Thank you. Two critical staff members in my team were Miss Bonnie Rosner and Ann Bissett, who expertly managed the day-to-day running of the command suite adroitly and without glitch. Bonnie and Ann, you are both outstanding executive secretaries, and please know that I truly value and appreciate what you have done. Mr. Sullivan, I'd like to thank you personally for mentoring support in the past 4 years. The unprecedented nature of what is being stood up here today has forced a struggle with our respective bureaucracies. And without your innovative drive and focus on the endpoint and your willingness to accept personal professional risk, we would not be here today. I admire you both for your persistence and wish you and Marilyn good fortune in the future, both personally and professionally. Captain David Beardsley, you have been a good friend, and I can assure you here today that Dave is eminently prepared to work with Mr. Sullivan to operationalize the concept of the Federal Health Care Center as the new CEO of Naval Health Clinic Great Lakes and then the Deputy Director of the Federal Health Care Center, meeting both DoD and VA missions. So Dave, thank you to both you and Ellen for your support over the past year. Dave. I have a number of family members here today because I'm actually from this area. My Uncle Marion, my Aunts Alice and Jeannie. I don't know if Aunt Rachel is here today. Also with me today is my brother John, my brother Brian and his family, my sisters Kathy and Laura, my sister Jeannie and her husband, Colonel John Correll. My nephew Justin and his wife and daughter Mallory, his wife Christy, my niece Kristen and her son Brandon, and my nephew Mark, who've come from around the country. Thank you all for being here today. This makes this special for me, and it means a lot to me. Thank you. Two of my children are here today, Timothy and Eileen's friend Fred Prescott. I am proud of all of you, and it means a lot to me that you took time out of your busy careers to attend today's ceremony. But I do have one task for you that I won't be able to accomplish, at least I don't believe so. 50 years from now, the time capsule for the Federal Health Care Center will be opened. Would you please let your sister Colleen know that you will all have to be there as I have placed something in that time capsule for you? No hints, okay? I'll be 106 if I make it, but we'll see how that works. And of course, and most especially, I'd like to thank my wife, Pat. For 8 years, for various family and personal issues, Pat and I have had to live apart except for occasional get-togethers. During this time, Pat, it has been your unwavering support during the easy and tough times that has allowed me to continue to serve this country of ours in the roles I have been assigned to undertake. I would not have been able to make it through these years without your unquestioning and rock-solid support. Thank you. I love you, and please, I would like at this time, Master Chief, deliver a token of my appreciation. Thank you, Pat. They told me I only had 5 minutes, so I'm kind of rushing here, and I skipped one very important person that I'm going back to, and that is my mother-mom. My mother-mom. How about my mother, Rosemary? Okay. My mother, Rosemary, retired 2 years ago at the age of 82 after a 60-year career as a registered nurse. Mom, you're an inspiration to the entire family and to me personally. Thank you, and I love you all. In any event, so let me move to wrap this up. The success of the Federal Health Care Center will not be determined by the glitz of a dedication ceremony or the data on healthcare statistics. Success will be determined by you, the warriors, the veterans, the retired DoD servicemen and women, and the families who receive care here in Great Lakes and North Chicago. It will be your call whether we're successful. This is about a commitment to you and who deserve the recognition and honor of this country for what you have done in supporting freedom for the United States of America. The FHCC, the Federal Health Care Center, is a partnership between two proud departments and two proud commands, both committed to serve those who have served. As Daniel Burnham, the architect of the 1893 Columbian World Exposition, said, "Make no little plans, they have no magic to stir men's blood." So my final message to the staffs of Naval Health Clinic Great Lakes and North Chicago VA Medical Center, really the future Federal Health Care Center, is this. Make no little plans. Ignore the naysayers and those with timid minds. Adopt a bring-it-on attitude and make this FHCC a success. My successes as the CEO of Naval Health Clinic Great Lakes were because of the people of Naval Health Clinic Great Lakes and the North Chicago VA. So let me close with a quote from a Chinese philosopher Lao Tzu from 600 BC. It's a reflection of how I view a leader's responsibility and command. It goes, fail to honor people, they fail to honor you. But of a good leader who talks little, when his work is done, his aim fulfilled, they will all say, we did this ourselves. To the staff of Naval Health Clinic Great Lakes, North Chicago VA, the Federal Health Care Center, be proud you have done this yourselves. Ladies and gentlemen, it has been my honor, it has been my privilege, it has been my pleasure to have served you for the past 4 years. Thank you.